Few diseases are as stealthy and alarming as Chagas, often called the silent killer, which is now making headlines well beyond its historic Latin American roots. Previously seen as a concern mostly south of the border, this potentially fatal parasitic illness is quietly spreading throughout the United States, raising urgent questions about detection, reporting, and public awareness. And here's the twist most folks overlook. Chagas disease could be sliding under the radar in countless communities. So what exactly is Chagas? It's an infection sparked by the Trypanosoma cruzi parasite, a microscopic intruder hitching rides on a group of blood-feeding insects popularly known as kissing bugs, scientific name triatomine bugs. The reason for their nickname? They tend to bite around the mouth, often while people sleep. But here's where the danger becomes real. According to the World Health Organization, up to half these bugs carry the parasite, and Chagas is responsible for roughly 10,000 deaths worldwide each year. Some cases cause sudden, dangerous reactions, including swollen body parts, allergic responses like anaphylaxis, or even acute heart issues. Yet, what sets this disease apart is its capacity to remain dormant in the body for years, frequently revealing itself only when it triggers life-threatening cardiac problems such as strokes or heart attacks. Recent scientific reviews, even those published in respected journals like the CDC's Emerging Infectious Diseases, show that T. cruzi-infected insects have now established themselves in 32 U.S. states, especially in the South and Southwest. Human cases have already been documented in 8 states: Texas, California, Arizona, Louisiana, Tennessee, Missouri, Mississippi, and Arkansas. And this is the part most people miss. Chagas doesn't only affect humans. Research points out that dogs, wildlife, including opossums, raccoons, armadillos, and coyotes, and even pets in places like Washington, D.C. and the U.S. Virgin Islands, have also tested positive for exposure to the parasite, broadening the disease's reach to 23 states for dogs and at least 17 states for local wildlife. But here's where it gets controversial. In most of the U.S., Chagas isn't a reportable disease. Unlike illnesses such as the flu, Lyme disease, or malaria, doctors aren't required to formally report cases to authorities or investigate them. This lack of a nationwide reporting system makes it nearly impossible to grasp just how many Americans are at risk or currently infected. Estimates range widely. One 2016 study put the number of American cases at roughly 300,000. While recent reporting suggests California alone may harbor as many as 100,000 people living with Chagas. You might think the biggest risk stems from bugs already in the U.S., but there's another twist. A study from California's Department of Public Health indicates that most infections here are actually acquired abroad, though local transmission does occasionally occur. Officially, agencies like the CDC and WHO still consider the United States non-endemic for Chagas, meaning sustained, continuous outbreaks are rare. But many experts are challenging this definition, arguing that underreporting and unfamiliarity among both the public and healthcare providers hide the true extent of the problem. Is Chagas really just the tip of the iceberg in American healthcare? For example, Gabriel Hammer, an entomologist quoted in recent coverage, bluntly described the U.S. cases as just the tip of the iceberg, citing the absence of national surveillance or standardized reporting as reasons for America's blind spot. His concerns echo those of epidemiologist Norman Beatty, who points out that Chagas has been a neglected threat in Latin America for generations, but now demands attention here as well. The World Health Organization estimates up to 75 million people worldwide may be at risk, many of who won't experience more than mild symptoms or any symptoms at all until the disease's long-term consequences strike. Here's a thought to consider and maybe argue about. Should health authorities step up and formally declare Chagas disease endemic in the U.S., launching stronger reporting and monitoring? Or is the current approach adequate? Are local communities even aware of this risk, given how quietly the disease spreads? Has anyone you know ever discussed the possibility of Chagas after a summer of camping? Or do you think the media is blowing this out of proportion? Let's talk about it. Do you feel safe? Or are we ignoring a lurking danger right in our own backyard?